I'm joined by Chris Skopec. He's the emergency team leader for the International Medical Corps and has just arrived in Benghazi today. Welcome to the programme, Chris. What more can you tell us when you arrived in Benghazi? What did you see, and what sort of tasks awaited you when you arrived there?
Well, when we originally arrived in Benghazi was towards the end of February. And we had to pull out with the security situation shifting so dramatically over the past week and a half. So re-engaging now, one of the first things we noticed is that the atmosphere here is very similar to as when we first arrived in February. The situation is quiet currently in Benghazi. There are stores open. There's people on the street. The general mood is positive. There's a substantial amount of celebratory gunfire in the street. However, people do remain somewhat tense. There's been talk of continued conflict in the city between some of the sleeper cells against the opposition forces. So it's a tense security environment for sure, but the overall mood is definitely positive.
Intense security prohibiting you in carrying out the job that you're hoping to do there?
Well, what we're looking to do is try to find where the most urgent needs in the health sector are currently. There has not been a lot of casualties from the conflict areas that are going to Skopec. There haven't been an overwhelming number that have been going to Benghazi. So considering the high level of violence that we've seen on TV and heard reports from in Ashdabia and some other heavily populated areas, our biggest concern right now is where people are accessing the kind of health care they need. We have heard reports, many reports in fact, that the hospital in Ashdabia took a direct hit during the conflict. We understand that it's no longer functioning. We know that before the attack on Ashdabia, the primary health care system was essentially closed down in the region. There were no clinics operating. The 7 in the area hadn't been operating since the beginning of the revolution. So it's really an urgent concern of ours at this point of where people are able to access care, emergency care and otherwise. So our plan right now is to travel to Ashdabia, bring the supplies that we have, human resources, medical personnel.
Okay, Chris, I'm afraid we're going to have to leave it there. I do apologise, but thank you so much for speaking to us. Chris Skopec there from the International Medical Corps.